Now please welcome to the stage the moderator of today's program, Charis Gomez, executive producer and host of Living Local DMV at DC News Now. She is joined by our first headlining guest, Dr. Tom Price, the 23rd Secretary of the Department of Health and Human Services.
Well, Dr. Price, so excited to talk to you today. Thanks so much for joining us.
Thanks. Great to be with you.
Well, you just heard some highlights on this study of U.S. Medical Professionals Survey. What are your immediate takeaways?
Well, thanks to PMI and thanks to the hosts and sponsors for this event, and thanks to all of you for coming out. I think it's important to set the foundation for this, and that is that cigarette smoking is a scourge, and that it is the largest preventable cause of death and disease in this country. 28 to 30 million smokers, 16 million folks have some kind of disease related to smoking. Mm-hmm. We spend about $250 billion a year taking care of those folks in this country. And yet we still lose almost 500,000 folks a year dying from some disease or cause related to smoking, including my own dad, who died at the age of 68 prematurely. Mm-hmm. So when you look at these statistics, this survey, which I think is incredibly helpful and incredibly important, you find a couple things. One is that the physicians, my fellow colleagues out there practicing medicine, they are clamoring for more information. Mm-hmm. I think in their heart they know that they haven't been brought up to speed on the kind of science that's out there right now, and these new products, as Pritika talked about. And they have said explicitly that if the FDA would actually give them the information, they would utilize it and let their patients know what this information was. So it's incredibly helpful, I think, the survey, and I'm so pleased that it was done. And we want to make certain, starting with this, to take this information and take it to the public and medical professionals.
So the updated science is there, and I think everyone can agree that we want regulation to catch up with the science.
Absolutely.
And you published in 2024 an op-ed declaring independence from smoking should be a policy priority. And in that you said that we need to take a realistic approach that embraces the truth about tobacco harm. What do you think that realistic approach looks like?
Well, when you saw the continuum of risk, mm-hmm. Cigarette smoking is horrendous. The combustibility, the burning of tobacco creates millions of byproducts, chemical byproducts, that result in the disease and the challenge that people have when they smoke. My own dad passed away from emphysema. He started smoking in World War II when they were giving him cigarettes, mm-hmm. And he smoked almost up until the day he died. But the challenge is that there are ways, and nicotine, it's the nicotine in the cigarettes that is addictive. So mm-hmm. that's what keeps people smoking. They don't smoke because they want to get sick. They smoke because they enjoy it. Many people enjoy it. But nicotine is incredibly addictive. But nicotine by itself is not terribly harmful to your health. It's mm-hmm. terribly addictive, and that's what keeps folks smoking. Mm-hmm. But it doesn't kill you. Mm-hmm. And that's the message that I think that regulators need to, they not just appreciate, which they do. The FDA has defined this continuum of risk and recognizes that smokeless tobacco, smoke-free tobacco consumption is much less risky. But we haven't penetrated that to where it needs to be from a regulatory standpoint and from an education standpoint. So when you see the statistics up here, I think that Pritika showed, the majority of health professionals in this country mm-hmm. believe that nicotine is a carcinogen. Let me say it again. The majority of health professionals, including my physician colleagues, mm-hmm. believe that nicotine is a carcinogen, and it isn't. And so if the doctors don't have the correct scientific information for whatever reason, and we can talk about what reasons that might be, but if the doctors don't have the right information, how can we expect them to convey to their patients the correct information? And then how can we expect patients to make the right decision? So the incentive for patients to move from combustible cigarettes, smoking cigarettes, mm-hmm. to a smoke-free tobacco product is huge, but that message isn't out there.
And I want to take a deeper dive into that. What do you think the reasons are that information isn't out there? We live in the age that information is everywhere. Everyone has the World Wide Web in the palm of their hands, in their pockets right now.
Sure.
So what do you think the reasons are?
You know, it's a great question, and this survey, I think, highlights some of it. But part of it is the stigma. Right? So there's an education lack of, because if you smoke, you're foolish, right? I mean, that's the that's the mantra. Well, nobody wants to smoke, so it's either all or none. It's this binary choice that was talked about on the previous panel. Well, that's not so, because there are so many things less harmful to one's health besides smoking that would satisfy this nicotine craving and addiction that many people have. So the message is, if you don't smoke, you ought not start. If you do smoke, you ought to quit. Now, sadly, that's kind of where it is stopped from an education standpoint in medical professionals and in most sectors of society. But the fact of the matter is that if you can't quit, and we know that about 25, 28 million individuals out there who want to quit can't, or are unable to do so, then you ought to change how you consume nicotine. You ought to change how you consume any tobacco product. How we get that to penetrate is through education of the public, education of medical professionals. The FDA itself, I'm enthused about the new acting director at CTP, because I think that there's an opportunity for somebody who understands the importance of regulation to actually move us in the right direction from an education and an adoption of smoke-free products that are out there. So I think we're on the cusp of something that can be very, very helpful from a health standpoint.
Absolutely. And I've seen, I know personally, a lot of advertisement or the media talking about alternatives. But the only thing I've seen personally has been that we need to keep it away from teens, but not necessarily how adults can access alternatives. So what are your thoughts on alternatives that give people access to nicotine, but not necessarily tobacco?
It is incredibly important, because, again, if you get folks to quit burning tobacco and inhaling it. Combustible.
Right.
Yep. Then you can move in the direction of having them have a better health status and be able to satisfy that nicotine craving. So that education is absolutely paramount, and we've got to do it. I'm glad that you mentioned youth, because it's one of the bugaboos out there that keeps us from moving, I think, in a good direction. The good news is that youth smoking and youth use of any other products is actually decreased. And so something's working out there in young people that is making it so that they are less likely to smoke and less likely to use any other product. The importance about these smoke-free products that I think is incredibly helpful, and that is, in addition to it decreasing the health risk for individuals, and that is that youth don't seem to be picking it up at all. It has no attraction for them. And so I think there's a great opportunity to, again, educate medical professionals, have the FDA recognize that it's their responsibility to regulate these products and to get them out there and to educate folks and move folks toward a better health style.
Very important. Now I'm going to ask you a big question that might take longer than the time we have today.
Why did the Braves lose last night?
Oh, you know what? And as a native Georgian in Atlanta, I think they played the Nationals, and I think they did lose.
Thanks
actually.
for the memory. Yeah.
So, no, why'd you have to remind us? He's like, yep, indeed, they did lose, but they did win last week. I will say that.
That's right.
I wanted to know, during your time as the 23rd Secretary of Health, I want to ask currently, what are your concerns for healthcare in this country, and what you knew then? What do you know now? What did you wish you knew then?
Well, so many things. I think that apropos this topic, science ought to be dictating our policy. And sadly, from a health standpoint, science hasn't dictated policy in the area of tobacco consumption. Especially with the smoke-free products and the heated tobacco products and the like. The good news is that there are thousands of people within HHS and within our health industry in the country, millions within the health industry in the country, who are dedicated to making certain that individuals have a healthier lifestyle. We need to listen to them. And that's, I think, where one of the challenges with FDA comes, because FDA has acknowledged this continuum of risk, that combustible cigarettes are the worst thing you can do, and then there's a risk, continuum risk, as you get moved down the stage of tobacco use. But that needs to be published. It needs to be driven home to the medical professionals so that the doctors can recommend to their patients an appropriate way to consume something that they're going to consume regardless. But they're harming themselves in major ways right now.
And I talked to you offline about Quit Smoking Georgia, something that my father was able to utilize in our great state of Georgia, even though the Nationals did beat us. And they have what is called the Georgia Tobacco Quit Hotline. Do you think we are missing something nationally, from a national standpoint, where people do not know about the alternatives and they have access to patches, gum, and nicotine alternatives?
Absolutely. There can be a public health service program, publication program. There can be encouragement by insurance companies to incentivize, from a financial standpoint, individuals that currently consume tobacco. That helps the individual, but it also helps the insurance company, because it's less likely that the individual is going to have a chronic disease if they consume something other than combustible cigarettes. So it's incredibly important for us to make certain, and states that have a Medicaid population, oftentimes that has a higher incidence of smoking than the general population. Imagine if every Medicaid program in this country actually incented individuals from a financial standpoint to participate in a smoke-free program process so that they get off cigarettes. How much more money could we save across this country? Many states right now, they tax these smoke-free products at the same rate as tobacco, which makes no sense at all. There's no financial incentive for somebody who's considering doing it. They say, well, shoot, the costs me just as much to buy a pack of cigarettes, and it's the devil I know compared to the devil I don't know, and why on earth should I switch? But if we make it an incentive from a health standpoint, we make it an incentive from an ease of use standpoint, and we make it an incentive from a financial standpoint, you've got a win-win-win, and we move folks in a better direction.
Well, I want to end this on a positive note, or a lighter note, and I want to ask you, what are you hopeful for with legislation surrounding tobacco products, legislation surrounding and regulations surrounding nicotine?
Well, I'm hopeful, and I mentioned the new CTP acting director, Brett Caldwell. Yeah. I'm hopeful that he will be able to move the FDA in a very positive direction as it relates to tobacco and nicotine, and recognize and publicize, and he's got the experience to be able to do that. From a state standpoint, I've had the privilege of going to different states around the country and talk to state legislators about the kinds of things that they can do to move us in a better direction from a state policy standpoint, both with their state health benefit programs as well as taxation of tobacco products, a lower taxation for smoke-free products. So there's so many things that can be done, and I am hopeful. I'm hopeful because of the interest of all of you in this room and the people that will hopefully see this. I'm positively hopeful because of the work that's being done. This survey work that has been done educates folks and lets them know kind of the foundation of where we ought to be when we're making decisions.
Well, hopefully your hope will extend to our Atlanta Braves and we get back to the World Series. Dr. Price, it was such a pleasure.
Thank
you so much for your time.
God bless.
Absolutely.
Appreciate it. Yeah.
Thank you.
Thank you.